We could think of psychedelics 2.0 as psychedelics that are slightly different and have an improved delivery technology, right? So that could mean that the trip duration is shorter. That could mean that maybe there's less nausea, or that more reliably can create a specific psychedelic effect.
I want to move on now to talk about some of the most exciting trends and developments you're seeing, because obviously you're at the cutting edge of this. What is exciting you about in the field of psychedelic treatments that might be coming around the corner, or some early research indications are showing us? Where do what keeps you awake at night with excitement about where we're headed with this?
We can call the existing psychedelics psychedelics 1.0.
Okay.
Right? This idea that they work and they're safe and effective for certain conditions. Mm-hmm. But every time in medicine and in drug development, there is the first in class and there is the best in class. Okay. So what we are excited about are the psychedelics 2.0 and psychedelics 3.0. We could think of psychedelics 2.0 as psychedelics that are slightly different and have an improved delivery technology, right? So that could mean that the trip duration is shorter. That could mean that maybe there's less nausea, or that more reliably can create a specific psychedelic effect that could, in theory, be more therapeutic.
Okay.
So that's like psychedelics 2.0. And then you have psychedelics 3.0, which are arguably novel compounds that have not been characterized yet. Examples of these could be psychedelics that do not produce hallucinations. So psychedelics without the trip. So how does this work? Well, these psychedelics promote neuroplasticity, promote the idea of like different neurons connecting within themselves and strengthening of those neurons. And so this could be more conducive towards psychedelics being adopted in the medical ecosystem, for example.
So if we're at 1.0 now, how far away is 2.0, and then how far away is 3.0 in your experience? Where do you think we are in terms of that?
Well, time will tell, in the sense of some of these, in the sense of all these drugs are still in what's called a preclinical phase. And so they haven't even been tested in humans, at least not in kind of like the regulated way. Mm-hmm. And so from when they're tested in humans, if they're approved, it will be 5+ years. So we shouldn't expect any of these compounds to hit the market in the next 5 years or so.
What might happen that means we don't get to 2.0? I'm trying to look down the path and see what obstacles there might be, regulatory issues. What do you think are the main blockers to this vision of 2.0 and 3.0 emerging?
Well, it's quite similar to the blockages that 1.0 psychedelics face, which is basically that the way that psychedelics are delivered is so different than how today we treat mental health patients. So we need this vast infrastructure that's just not built yet. And this infrastructure means trained therapists, mean also specialized clinics. Mm-hmm. The way that, one way to think of psychedelics is as experiential medicine. The experience of being in the medicine is what's therapeutic. Compare that to going to a psychiatrist's office where they will prescribe an SSRI and you just go home and take that SSRI every day. It's just so different that we need gigantic infrastructure that's not available yet. So that's one point. Okay. And then the second one is related to who will pay for these treatments, right? These treatments are expensive. Being in front of a therapist or a practitioner for multiple hours is expensive. And so we need to have the data to show, and the clinical outcomes to show payers, these could be private insurers or single payers in the UK and other places, that these are safe, effective, and cost-effective ways of treating mental health disorders.
I want to talk about the intersection of psychedelics and neurotechnology. What do you see the role of those two areas coming together to improve patient outcome, for instance?
Well, one way to think of neurotechnology is around tackling or fixing dysfunctional brain circuits. And so the idea of like different brain circuits connecting within themselves, and psychedelics potentially act in a similar way, or one way that psychedelics act is in a similar way. So I could see these two fields being complementary. Ultimately, what I believe is that we need to have more tools in our toolbox to meet patients where they are, and also understand that all these diseases are extremely heterogeneous, right? And so two patients that are being diagnosed with depression may be extremely different, and there may be extremely different treatments that work for each one of them. So what to me is exciting of neurotechnology is it's just one more effective tool to treat certain patients.
And would breakthroughs in genetic understanding lay into that as well? The better you can understand how someone is made, the more direct you could be with psychedelic treatment, for instance. You see that being part of the puzzle as well?
Absolutely. One area that we are extremely excited about is precision psychiatry. If you think of oncology, cancer, in the past 20 years, we've gone from characterizing a cancer as a lung cancer, stomach cancer, to understanding what is the genotype, what is the phenotype, what is the mutation pattern of that cancer. We don't have that in mental health still. So I'm extremely excited about genomics and different types of technologies that will help us characterize patients in a way that's more accurate, so then we can develop treatments that are specific for that subtype or subpopulation of patients.
When you look at psychedelics, the fields of research around that with neurotechnology, with genetics, we're talking about huge collaboration across multiple disciplines. Is that for you a source of excitement and opportunity, or hesitation that we're asking so many different fields to work together for the common purpose? Because that's not something maybe historically there's a great track record of.
Well, usually innovation happens at the intersection of multiple fields, right? And so I'm excited about that. We as investors, early stage investors in companies, we are in the business of innovation and backing things that are just not a reality yet. And so the only advantage that we have and the early stage companies have is doing these things that are at the intersection of multiple places.
So you've talked about 1.0 and 2.0 and 3.0. Could you explain, if you can, what that's like from a patient's perspective? What would a treatment look like if you're experiencing the treatments at 3.0 compared to what you would be now?
Well, one option that it could mean is not having the hallucinogenic journey. So basically taking this compound at home, and maybe having this compound as complementary to classic psychedelic. Another example of this could be a milder version of, let's say, MDMA, where someone or a couple could take it at home without needing to go to the clinic, and they could work through whatever issues they're dealing with in the comfort of their own home. So those are a couple examples. I would say another one is that certain compounds are contraindicated when someone's on SSRIs, for example. Mm-hmm. So an example of this would be a psychedelic compound that could be taken in conjunction with SSRIs.
So a way of looking at it is 3.0 is all of the benefit, none of the side effects. What's 2.0? Is that just the halfway house of getting closer to that completely risk-free treatment?
Definitely. It's somewhere in the middle. It's shorter term in terms of like when it's coming. It's less risky or more likely for these compounds to exist in the world, where what I call psychedelics 3.0, although I have no doubt that some of those compounds will come to market, we just don't know which ones. It's really risky still and early.
And what excites you most about psychedelic therapy? And conversely, what are you most worried about?
Well, what excites me the most is that they treat the root cause of the disease versus just masking symptoms, which is what we've been doing in mental health for decades.
And what worries you the most?
What worries me the most is that either we don't have the investment needed to show that these medicines are safe and effective. What worries me the most is that we may not be able to build the infrastructure that's needed for psychedelics to come to the medical market. And ultimately, also, it just worries me that we as a society don't prioritize mental health as one of the most important things that, or crises that we need to solve in our generation.
Can you give a few examples of some of the startups you've worked with and what you've loved about them and what's made them stand out?
One example is Delix Therapeutics. It's a company that spun out of UC Davis, and they develop non-hallucinogenic psychedelics. So they call these compounds psychoplastogens because they can promote neuroplasticity without actually having to trip. And so this could be administered in conjunction with a classic psychedelic or not, but the idea is that by promoting neuroplasticity, you can strengthen connections between neurons. And it's been found that this is something that is needed or a pathology for folks experiencing depression, for example. Another example is a company called Freedom Biosciences, which was started by the chair of psychiatry at Yale, Dr. John Crystal. And Dr. Crystal has been studying ketamine since the 90s. And he found some of the antidepressant effects of ketamine. And what Freedom is doing is developing a combination therapy of ketamine with another compound that extends the therapeutic effect and window of ketamine.